Hey guys, my name is Jessica Leichtweisz and I'm the CEO of Hope Education Services. I'm passionate about helping families affected by autism, and almost every day parents just like you send questions to me. Sometimes I can answer them, and when I can, I do, no matter where I am. Sometimes you'll see videos of me at the gym, of me hiking, taking selfies, answering your questions. No matter where I go and whatever I'm doing, I want you to know I'm thinking about you. Autism doesn't stop for your family, so I don't stop making content for your family. Sometimes though, some of the questions I get, I'm not qualified to answer. And when that happens, I'm always excited to bring on someone who is. So today I'm going to bring on Dr. Yasemin Baldik. She's a friend of mine, and she's agreed to come on and answer a question that a parent asked. And that's, if a child with autism has aggression, what are some of the medications that can help to ease that? So just before we have our answer, I just want to make sure everyone who's watching this video, please do not take this as information that is directed at your child. This is general information only, and please, this does not constitute a patient relationship. We have disclaimers on all of our videos, but due to the fact that this is a medical question, I just want to make sure everyone understands that whatever we talk about today, you're going to need to speak to your doctor about, and this is just for reference. So Dr. Yasemin, thanks for coming on here today.
Thank you. Thank you for inviting.
So if a parent has a child that has aggression, let's assume they're a teenager, what medical interventions, we working on behavior from my perspective, but what are some of the actual medications that they could use, and do you recommend that they use medications to help the treatment?
So before we talk about medication use, always we should go to the bottom of the problem. Why is the child becoming aggressive? And we should explore the reason behind the aggression. In particularly in autistic kids, they have low tolerance to the external stimuli and changes in the environment, and that can make them aggressive. And they can also have comorbid condition. They can have comorbid anxiety, comorbid depression, and comorbid psychotic disorder. Those are the one of the reasons to be aggressive. So first of all, we should address what's the underlying cause for aggression, and after trying all revenues and therapies, behavioral therapies, or applied behavioral therapies, if the aggression or the anger outbursts cannot be tolerated, cannot be subsided, then we consider medications. For the aggression per se, two main classes of medication we use. One group is the antipsychotic medication, and the other group is mood stabilizers. In antidepressant, in antipsychotic spectrum, there's two medications that is approved by FDA for the treatment of aggression in autistic children, which is risperidone and Abilify. Those are the choice of antipsychotic medications in aggression. In autistic kids, because they are approved by FDA. But if they are, if we cannot get enough satisfactory results, we can always try different antipsychotic medication. One of the antipsychotics that are tried is Seroquel, or we can go the old generation antipsychotics can be tried also. But first choice is either Abilify or Risperidone. It's not uncommon that we may try mood stabilizers if the mood swings are very severe and severe mood dysregulation is associated with aggression. We try mood stabilizers. Also, anxiety disorders and obsessive compulsive disorders are very commonly seen in autistic kids. And first medication of choice would be antidepressant medications, and we use sertraline, Prozac, and in other antidepressants in the same spectrum. So these are the main medication. Also, autism spectrum disorder is commonly comorbid with ADHD. There's a big discussion about that. It's hard to diagnose ADHD in autistic kids, but usually small dose of clonidine, as well as ADHD medications can be also tried if the ADHD is a comorbid condition. So it depends on what comorbid condition is associated, or what are the outside stimulants causing the aggression. The treatment modalities can be tailored.
Yeah, and I think it is important that Dr. Yasemin brought up that one of the symptoms of autism, or one of the effects of autism, is typically not aggression. Now, I have personally witnessed aggression, and I've worked with hundreds of kids with autism. You know, when children get older, there are some times when children are aggressive out of frustration and a lack of communication, but more often than not, it is a comorbid condition. It's not the autism causing the aggression, and I think that's really, really important to find out. So knowing that we're not necessarily treating the autism with medications, we're treating those comorbid conditions that children with autism or adults with autism are more likely to manifest. So, you know, if you are watching this video and you're a parent, you can talk to your doctor about medications, but also know that most children do respond really well to behavior treatment. So, you know, I'm an ABA therapist. I've worked with hundreds of kids. Of those kids, a handful of them needed to be on medications, and that's because they truly did have a second condition that needed to be treated with medications, but most kids really do respond well to just doing something like a functional behavior analysis and putting in a behavior plan that everyone in the child's environment, their teachers, their therapists, their parents, their grandparents, you know, their babysitters, whoever's working with that child is aware of how to help that child with a certain behavior. Typically, we can see a huge decrease in undesired behaviors and even aggressive behaviors. So I really hope that this video was helpful. And if you're watching this on Facebook, I make videos just like this. If you have questions about autism, I love to answer them. It's one of my favorite things to do. It's like my passion. One of the first things I think about every morning when I get up is, who can I help today? So please help me help you. Go to getautismanswers.com. That'll take you to my YouTube channel. Subscribe to the channel. If you have a question, just chat it in the comment of this video. I read every single comment. I answer to every single comment. If you have a question, I will do my best to answer it. And if I can't, I'll bring someone like Dr. Yasemin on who can. So thank you again for coming on.
Thank you for inviting.
My pleasure, and I look forward to connecting with everyone there.